For the past 50 or 60 years or so, Americans have been suffering from a rise in chronic conditions, chronic diseases, such as diabetes and MS and Parkinson's and Alzheimer's, as well as chronic conditions such as back pain, chronic back pain, unrelenting, neck pain, migraines, cluster headaches, shoulder pain, elbow pain. It goes on, arthritis, rheumatoid arthritis. A unbelievable amount of chronic conditions that U.S. citizens are suffering, and a lot of money is being spent on trying to solve these problems. Now, how do we try to solve these problems today? Is we use it through treatment, traditional treatment such as physical therapy or medicine, non-traditional treatments such as acupuncture, hypnosis, all kinds of strange therapy, chiropractors. And what has happened is that a lot of money has been spent, a lot of effort has been put into this, but there hasn't been that great results that we're getting. There hasn't been a solution to these problems. I want you to understand something, that there could possibly be a solution or help for these types of problems, and it could be a lot simpler than what we've been pursuing lately. Our body and our brains, this is research that has shown that needs three things to function normally, for everything to function normally, for our hormones to function normally, for our brains to function normally, for our kidneys, heart, everything to function normally. The first thing is activation. Our brain, our body needs to be activated. Our hormones need to be activated properly. The right amount, not too much activation, not too little activation. Okay, that's number one. Number two, it needs oxygen. Our body needs oxygen. Not too much oxygen and not too little oxygen. Now here's an interesting fact about oxygen. Our lungs are not able to process oxygen as efficiently as if we were younger. Every year of life we lose about a percentage point of oxygen capacity and the ability to process the oxygen capacity for every year of life we live after the age of 20. So that is something that needs to be looked at. Finally, the food we eat, which is represented by this G, or glucose. Our brain needs glucose to function normally, and it needs the right amount of glucose, not too much and not too little. These are just three of the basic things that our brain needs that I believe we are not addressing properly. So let's just demonstrate here. The average American takes about 10 pills a day. That could be medication prescribed by their physician. That could be supplements. That could be something they got over the counter, like Advil or ibuprofen, whatever. About 10 a day. So let's take a look at what that might fill up our body and our brains with. Now, 10 a day is about 3,650 pills. I don't have 3,650 pills, and I wasn't about to count out 3,650 pills, but I just want to demonstrate this is about 1,700 pills. So let's just put that in there. It's a little bit filled up. Let's put that in there. Okay. Let's get a couple more. Again, we're not quite there yet. We're not even close to 3,000. All right, it's getting pretty full. That there, that's kind of pretty. That's about 1,700 pills. Wow. That's a lot of supplements. It's a lot of medication. That's also a lot of money to be spent. That is just about half of what the average American takes. A little less than half. Do you think there might be a better way? Let's take a look. What I'm going to do is dump all those pills out. And let's try again. So, remember what I said. There are three things our body desperately needs in the right quantities and from the right sources. Activation, that fits. Oxygen, and the right kinds of food or glucose. There you go. Doesn't look as pretty, but it doesn't take as much space, and it actually might solve the problems. Now, medication and supplements are necessary. I'm not saying they're not necessary, but the amount you're taking may not be necessary, may not be doing you any good, and may actually be hurting you. You need to take care of these three things first. And when those three things are taken care of, then we can see if there are problems that need addressing with medication or supplements. Remember, to live better, you need to eat better, and you also need to be active better.